children infected with the virus that causes COVID-19 have either very mild symptoms or asymptomatic. In other words, they don't have any symptoms at all. You can't tell they're infected. So while they are still able to transmit the virus to others, they don't display any symptoms, and parents wouldn't necessarily know they're infected unless these children are tested for some reason, such as they were identified as a contact to a known case or some kind of surveillance testing. Idaho children 12 to 15 years of age make up just over 3.5% of the cases in Idaho over the course of the pandemic, and just under 1% of those kids were hospitalized for their illness. Conversely, kids in this age group are 1.5 times more likely to be asymptomatic when compared to Idaho adults. So while they may be a small proportion of the total cases, infections in this age group are likely undercounted because they don't display any symptoms and may never be tested or diagnosed with the infection. So all that said, there is a condition called Multisystem Inflammatory Syndrome in children. This is abbreviated as MIS-C. And it is related to infection with the COVID-19 virus, specifically in children. The syndrome appears to be a result of an excessive immune response to the virus, and different systems in the body become inflamed, and it seriously affects all different organs and systems throughout the body, including the heart, blood vessels, kidneys, digestive system, brain. And right now, scientists are trying to get a better understanding of what triggers this sort of exaggerated immune response. However, there are some things we do know about the syndrome. First, we know that most of the children affected have a positive serologic test for SARS-CoV-2 and negative viral tests. So what this means is they aren't actively infected with the virus that causes COVID-19, but they have antibodies that indicate they were infected by the virus at some time and they had this infection and it wasn't detected. This finding supports the hypothesis among researchers that the syndrome is related to an unusual immune response that occurs after acute infection has passed. We also know that in children who have a known history of COVID-19 disease, so these are the kids that they were identified as being infected in the acute phase, the time between their acute infection and the onset of MIS-C symptoms is approximately 2 to 6 weeks. Unfortunately, for many of the cases, the duration of time between when they had that acute infection and when they started experiencing symptoms of MIS-C is unknown because they never had a positive viral test or had symptoms of acute infection. So children with MIS-C may have a fever and other various symptoms, including abdominal or tummy pain, vomiting, diarrhea, neck pain, rash, bloodshot eyes, or just complain that they're feeling extra tired, or maybe a parent observes that they're extra tired. These are the signs parents should watch out for and notify their healthcare provider about. 26 cases of MIS-C have been reported in Idaho, and among those cases, on average, 4 body systems have been impacted. The most frequent is hematologic system, including the blood vessels. Second most frequent is the gastrointestinal system, including the liver, and the third is the cardiac system, your heart. 62% of Idaho cases had an exposure to a known case of COVID-19 in the 4 weeks prior to their symptom onset, so we know that those children were exposed to a confirmed case. Idaho kids spend an average of 4.5 days in the hospital. It was 5.8 days for those who were actually admitted to the ICU, which is about 58% of Idaho cases. And those children spent an average of just over 4 days in ICU. The average age of those admitted to the ICU is a little bit older. It's 11 years compared with 7.5 years for those who are not admitted to ICU. Now, I did want to walk you through Idaho cases compared to the U.S. So this is a comparison of Idaho cases to the characteristics of cases in the U.S. So far, there have been 3,185 cases reported nationwide, including 36 deaths, and that represents a case fatality rate of just over 1%. In Idaho, our 26 cases have been identified, but thankfully, all of these children have been discharged from the hospital, and we've had no deaths reported. A slightly lower proportion of Idaho cases are of Hispanic ethnicity, but this proportion does align pretty closely with the proportion of children in Idaho who are of Hispanic ethnicity, which hovers just under 30%. And as you can see, the median age of cases is identical when you compare the US to Idaho. And while our data do skew a little bit older, we do not differ much with regard to the age distribution of cases.